Ready? Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and I'm joined today by Mayor McNamara of the City of Rockford. Talk a little bit about some success yesterday at Ellis Elementary. We had a school event in collaboration with Walgreens, Rockford Public Schools, and the Rockford Ministers Fellowship. Through this community collaboration, 950 individuals were vaccinated with the zip code focus on 61101 and 61102. And I had the pleasure of meeting several individuals, but I met my first centenarian at the clinic. So someone over the age of 100 seeking vaccination, so with a sense of optimism and hope. So again, I want to thank Walgreens for their corporate support in bringing out the vaccinators. Rockford Public Schools stood that site up with volunteers, and the Rockford Ministers Fellowship, who help us bring clients into that site. We hope to offer more pop-up sites throughout the vaccination effort so that we can get to our hard-to-reach community areas. But vaccinations to date, 27,920 vaccinations have been administered through the Winnebago County Health Department. And I want to be clear, that's not through all different locations in the county, that's just the health department. And 21,000 have been administered with support of the Illinois National Guard since February 23rd. This week, we are working through second doses. If you remember, we started February 23rd, so that means we're working through second doses this week. 44% of all vaccinations have been administered to individuals 65 and older, and 38% are being reported as fully vaccinated. So we are clearly making progress in the right direction. Obesity, diabetes, and lung disease have been the top 3 reported medical conditions that those who have undergone vaccination have reported. And our top 3 industries have been education, healthcare, and manufacturing. So we're clearly getting to our Phase 1B essential frontline workers. 85% have reported themselves as Caucasian, and 6% have reported themselves as Black or African American. We clearly have a lot more work to do if we are going to cross that health equity divide. And to date, the teams have been using all 3 vaccine products, Pfizer, Moderna, and the new Janssen COVID-19, also known as the Johnson & Johnson product. But I want to give a special shout out. We talk about the Illinois National Guard mass site, but in recognition of my colleagues at Rockford Public Schools and the school nurse vaccination effort, who gave 1,165 second doses at Jefferson High School on Friday, almost topping the Guard site for the day. So through their efforts, they've been able to vaccinate their school personnel. When you look on the Illinois Department of Public Health website, which reports on all vaccines administered in Winnebago County, so this includes healthcare centers, pharmacy partners, in addition to the health department, 84,000 vaccines plus have been reported as of noon today. They're reporting approximately 11% of the population is being fully vaccinated at 10.66%. And 83% of individuals 65 and older have received at least 1 vaccine dose, and 28% of individuals 65 and older have been fully vaccinated or completed their series. So that was that first part of Phase 1B, and we continue to catch up our Phase 1B plus now. So we often talk about the health benefits of being vaccinated, but I remind people of the social benefits. And we talked a lot about this yesterday at Ellis. So with vaccination comes, we call the privilege of membership in the vaccination club. You can gather indoors with fully vaccinated people without wearing your mask. You can gather indoors with unvaccinated people from one other household without mask unless one of them is high risk. So especially as we look toward the Easter holiday and the Passovers and other holidays that are coming up, this gives some of our population of over 65 something to be hopeful and optimistic about, as well as being able to see the younger members of their family unit. If exposed, you do not need to quarantine or get tested unless you develop symptoms. And the benefits of vaccination is not only do you protect yourself, but you protect those around you. So I often hear from individuals, and even yesterday when they bring family members in to get vaccinated, someone would say, I don't need to get vaccinated, I don't get sick. But when you vaccinate, you protect those around you. So just a reminder, you still need to register. I wish there was a different way to get it to you, but you got to register. Go to online at www.wchd.org If you need assistance to register, you can call our COVID hotline at 815-319-6705. But many of our churches in the area are working to support individuals with limited technology. We understand that people may need assistance, and therefore these churches and volunteer groups have stood up to help individuals. But the most important thing is it's kind of like registering to vote or buying that lottery ticket. If you want to get vaccinated, we need to know you want to be vaccinated. You've got to register. Like voting, you may not like the choice. You may decide to opt out at the end. But the most important thing is to let us know that you're interested, and we will do everything we can to get you vaccinated as quickly as possible. The good news was with quarantine. Last week we announced with the positivity rate below 3% consistently and increasing availability of vaccinations that Winnebago County will be implementing the CDC guidance on quarantine and isolation, which went into effect on Monday, March 8th. So we'll only quarantine 10 days without testing or 7 days with a negative test at day 5 or later. So we're hopefully shortening that period up for individuals so they can return back to their lives and work environments. I'm getting a lot of calls about spring break plans, and I can't imagine why with the nice snowstorm we have going on right now. You need to continue to monitor the travel guidance. There are areas in the country where we do have pockets of outbreaks of infection, and it's very important if you're traveling to those areas that you understand that. You need to continue to practice your social distancing, your masking, frequent hand washing, and avoiding large gatherings. And remember, while you as an adult may have been vaccinated, if you're traveling with other members of your household who have not been vaccinated, that you need to protect them as well. And you may have to quarantine, again, with a shortened period of time if you're unvaccinated upon your return. And your children, while you may be vaccinated, you may not have to quarantine, but they may have to quarantine until they can return to the in-person learning environment. And I really need people to be mindful about this because we are approaching, and I know Rockford Public Schools is going for their date in April to return children to the in-person learning environment. That spring break is not a time to let our guard down and really continue to be cautious about this. We want to return our children for the end of the school year and be able to transition because we know that we're going to aim for the fall with full in-person learning available to all. Contact tracing continues to identify positive cases, so I'd want you to know that the case level is not zero. We continue to have cases. So we are reporting 72 new cases from Saturday to Monday. The ages are anywhere from 10 months to 87 years of age. And throughout this pandemic, we've reminded individuals no age range has been spared. Our test positivity rate is below 3 at 2.6%, and 2% with a death rate of 2% and recovery rate of 98%. But I remind people, recovery rate does not mean that you do not have sequelae. That does not mean that you are not a long hauler. It means simply that you survived the infection rate. This is a disease that we are still learning more about every day. And while we're reporting no new deaths today, we are marking 1-year anniversary of the first COVID case in Winnebago County, which occurred on March 14th. And I want to remind our population of the 447 individuals that we have lost to this disease throughout the pandemic. And our heartfelt condolences go out to those families. And so while we look for hope and optimism, remember that they are still in a grieving process as we move through this pandemic. There are no new locations of concern to report, and we do want to offer congratulations to locations that have completed 2 incubation periods without any new cases: Milestone in Elmwood Heights and Walter Lawson Children's Home. So with that, I'm going to turn it over to Mayor McNamara.
Good afternoon, and I hope you're all enjoying a beautiful spring day here in Rockford. Again, thank you, Dr. Martell, for your leadership and your team's leadership. As you just mentioned, it's been about a year since the world as we knew it underwent a radical change thanks to COVID-19 pandemic. And it's almost to the day that we first had our first case here in Winnebago County, and we had our first regular news conference announcing that first case. Want to just take a quick look at some of the numbers nationally and then here locally. So in the United States, we've now had more than 29 million cases. We've had over 530,000 deaths due to COVID. To put that into perspective, that's the city of Atlanta or the city of Kansas City or Sacramento. Here in Illinois, we've had 1.2 million cases with 23,000 lives lost. And in Winnebago County, as Dr. Martell just mentioned, we've lost 447 lives to COVID-19. Tonight at council, we'll certainly take a moment of silence for those lives lost. But as Dr. Martell said, we talk about the numbers, we hear the numbers, and you hear a lot about them nationally. But here, they're obviously friends, family, neighbors, coworkers, colleagues. And now they have one less person at their dining room table for dinner, and that's just a huge void in their lives, and we certainly are continuing to keep them in our prayers. In addition to the tragic lives lost, there's also been a whole host of other challenges that we've undertaken throughout this year. We've seen economic devastation while we work to control the spread of this virus. We've seen lower levels of educational attainment from our young people. We've seen increases in mental illness. We've seen dramatic spikes in violent crime. We've had to stay apart from our close family and friends, especially often when you need them most at funerals and weddings and large family gatherings. We've seen weaknesses in our social safety net and in our healthcare infrastructure. All of these challenges have tested us in ways that we've really not been tested before. However, in Rockford, we are meeting those challenges how we typically do, meeting those challenges together and head on. We've seen children, and I call these little rays of light that we've seen during this really dark time. We've seen children putting hearts on their windows. You can see them right behind you here at the health department, providing that inspiration and hope to passersby. We've witnessed heroic actions of our healthcare workers and our first responders as they continue to work on the front lines of this pandemic, and their work continues even today. We've been marveled as our community has stepped up, everyday citizens donating what they can to food pantries to provide thousands of dollars worth of food to those families in need. We've seen our teachers and our administrators and our facility managers totally reprogram what a school year looks like and change their curriculum to adapt to this virtual environment. And across our community, we have, at nearly every chance, adapted, overcome, and improvised. Now, though, as it's been dark, as I've mentioned, we're finally starting to see even more rays of light. I want to say a huge thank you to the partnership of numerous organizations that now have had the vaccination site up at Sandy Hollow and 11th Street for now just over 3 weeks. We've done, as Dr. Martell just mentioned, now over 21,000 vaccinations there, and a huge thank you to the National Guard. We continue to refine those operations, and as supply grows, we hope to vaccinate more and more individuals at that site. And as Dr. Martell said, I think one thing that was very exciting is how quickly the health department's team, the Minister's Fellowship, in partnership with Rockford Public Schools and Walgreens were able to provide nearly 950, or just over 950 vaccines, which is just wonderful at Ellis School. As you've heard Dr. Martell, we're getting ready to announce that second site on the west side, which is exciting. That needs to be done. This is all of us. This is good news for everyone who lives in Winnebago County. We at the City of Rockford and also our counterparts in Winnebago County also saw a large ray of light with the passage of the American Rescue Plan that is bringing about $54 million to the city and about $54 million to Winnebago County. Both Rockford and Winnebago County get those funds, and we at the city will certainly be working with Chairman Chiarelli, the City Council, and the County Board to ensure that we can leverage those dollars to make the greatest impact in our area. As this tough year continues to progress, I would just say continue to be vigilant, continue to wear your face covering, make sure that you're registering, make sure when you register and you get an appointment that you go to your scheduled appointment. And if there's something that comes up and life does come up, make sure that you call and notify the site that you can't be at your appointment. I'd also just encourage everyone to work together and stay together and check in on your neighbors as we continue throughout this pandemic. And we'll take questions.